Are you suffering from heel pain? Do you hobble in the morning after getting up because of heel pain? Then this video is definitely meant for you. Today, let us see what are the causes of heel pain, what to do if there is pain in the heel, what is the treatment for heel pain. The most common cause of heel pain is plantar fasciitis. So let's know more about plantar fasciitis today.
First, understand structure of the foot. This is the heel bone or the calcaneum, the bone that makes up the heel. There are two structures attached to it. One, a tendon called as Achilles tendon, which is located behind the ankle, and one more structure called as plantar fascia, which is beneath the bone. It starts from lower end of the heel bone, the calcaneum, and then spreads out throughout the foot and reaches right up to the toe bones. As you can see here, the plantar fascia, this structure called as the plantar fascia that you can see here, starts from the heel bone, spreads throughout the feet and goes right up to the toe bones. The place where it gets attached to the heel bone at times tends to get inflamed or swollen, and this is exactly what causes pain in the heel, and this is something called as plantar fasciitis. For the majority, it is located right here in the heel beneath the foot. However, for a few, it may be located anywhere in this red area. At times, the swelling of the plantar fascia or plantar fasciitis can be caused by an overgrowth of the bone here. As you can see here, this is called as calcaneal spur, and at times it can be even without this bony outgrowth. This bony outgrowth that you can see here, the calcaneal spur, is also seen on an X-ray as a spur, as you can see here. How does plantar fasciitis manifest? It causes heel pain. This heel pain is maximum in the morning, particularly immediately after getting up in the morning, and it is also more one when one gets up after prolonged sitting. What tends to cause plantar fasciitis? The risk factors: obesity, purely because of the weight on the heel bone, tends to increase chances of plantar fasciitis. Work that involves prolonged standing, prolonged walking, tends to cause irritation of the heel bone, the plantar fascia, and cause plantar fasciitis. Pregnancy also tends to increase the risk of plantar fasciitis. Flat foot, because of abnormal pressure on the plantar fascia increases the risk of plantar fasciitis. Athletes, because of their sports activities, are more prone to plantar fasciitis. Improper footwear, because it leads to abnormal pressure on the plantar fascia, can lead to plantar fasciitis. And lastly, ankylosing spondylitis, a type of arthritis that causes inflammation or enthesitis. Enthesitis means inflammation at sites where ligaments, tendons, or muscles attach to the bone. Since plantar fascia attaches itself to the calcaneal bone, this area is enthesis, and there is inflammation of the enthesis in ankylosing spondylitis. So it is also one of the important reasons that causes plantar fasciitis. This is what a flat foot looks like. Generally, there is a clear-cut gap between the foot, the lower end of the foot, and the floor. But in this foot, as you can see, there is no gap at all. The lower end of the foot is straight away touching the floor. This puts excessive pressure on the lower end of the calcaneum, and this leads to swelling in the plantar fascia and consequently plantar fasciitis. How can you know if you have flat foot? You can stand the way this lady is standing and look at your feet in the mirror, or you can keep a mobile a few distance from your feet on the floor and click a photo, and this is something that you can clearly show you whether you have flat feet or no. What can be done for plantar fasciitis? Ice fermentation definitely helps. Ice decreases the inflammation of the plantar fascia and can help. NSAIDs, or non-steroidal anti-inflammatory drugs, they reduce inflammation of the plantar fascia and does reduce pain of plantar fasciitis. And lastly, plantar fascia exercises. We do have a detailed video of plantar fascia exercises coming up. Do have a look at it next week. However, one simple exercise that you can always do is take a ball or a bottle or a roller pin, put it on the floor and roll your foot on top of it. As you can see here, the ball is kept on the floor and you can roll your foot on top of it. How does this help? This tends to massage the plantar fascia that is inflamed and reduce the inflammation due to this. This is to be done one when you get up in the morning before you actually start walking. So you should keep this ball or bottle or roller pin just next to your bed. The moment you get up in the morning, first roll your foot on top of this and only after that you start walking. And secondly, you can do this before you go to bed as well. To reduce inflammation of the plantar fascia, one should use soft footwear. Soft footwear not just for outdoor purposes, but even in the house it would be better if you use a soft footwear so that the inflammation of plantar fascia is reduced. For outdoor purposes, if you cannot use soft footwear or sport shoes, this is something that can be used in formal shoes, silicone heel cup. It's a small, soft, silicone based material cup which is kept at the area of the heel. Because of its soft nature, it reduces the irritation and inflammation of the plantar fascia. This can be used throughout the day and is kept inside the footwear in the area of the heel. As far as flat foot is concerned, one can get a proper foot analysis done. Once the foot analysis is done, a special footwear or an insole is designed, and this is something that can take care of the flat foot, reduce inflammation and irritation of the plantar fascia and help in reducing plantar fasciitis. If all these measures do not work, a steroid injection or a PRP injection can also be tried to take care of plantar fasciitis.
Thank you viewers for tuning in. Let us meet next week with another video. Thank you.